EP's too low. I can't find a vein.
he's still trying. He's still trying to get a vein. Mate, but it's too late now. It's too late now. How's it going, guys? It's me, Dr. Mim again. Doing a little bit of a different video today. So I mentioned in my last video that I haven't really watched many medical dramas. So I thought, why not start with what is probably one of the most critically acclaimed, medically accurate shows available right now. Forget your House. Forget your Scrubs. Forget your Grey's Anatomies. We're talking, of course, about ATTAWAY General. So I've seen some clips online, but I haven't actually watched any full episodes. I've not watched any medical shows for God knows how many years. So why not break that streak with possibly one of the worst medical shows that is in existence. But you know what? I'm going to be a fair judge. I haven't seen any full episodes, like I said. So without any further ado, let's just get into it and see what this is all about.
The Teen Volunteer, or TV program, is what you make of it. The more you prove yourself, the more rewarding your time will be.
When will we get to observe in the ER?
Wait, is this going to be like exposition, theater, performance style kind of thing? Like, why is she looking straight at the camera? What's going on?
The ER is usually reserved for third-year TVs. Any questions? Jack.
Yeah, what time do we get off?
Yeah, what time do we get off? Like, I'm so cool. Like, I don't even want to be here. Like, I'm a volunteer, but like, I just don't want to be here right now. Go home then. Isn't that like the point of being a volunteer? You're choosing to be there. Anyway.
I'm gonna pretend like I didn't hear that. Oh, and if I so much as hear a phone on this floor, it's mine. And do not test me because I really need a new phone.
So I think this has probably changed nowadays. Like, there's not really any problem with having your phone ringing on the ward. You know, we use phones more and more nowadays. It used to be just the pager or the bleep, as we call it in UK, which is like that ancient thing that you can call using your phone and it will just let off a beep, hence the name. But yeah, nowadays, most people do use phones. Like, if you're doing any referrals, if you want any advice from someone, generally you put a mobile number and they'll call you back. So you shouldn't really be surprised if you see doctors or anyone else using a phone on the wards. Pretty normal now.
ATTAWAY ER. Okay, how far out? Trauma team on standby.
This is Nurse Sandy. She's the heart of the ER. Make her laugh and bring her chocolates, and you're golden. But if you make her mad, you're gonna have a really rough road at this hospital.
ATTAWAY.
So yeah, I don't really think it's good to portray hospitals as these kind of like hierarchical structures where like, oh, if you have to get on this person's good books, if you don't do that, then everything's going to be rubbish for you. Yeah, that's kind of how it was for like a long time. But I feel like we're kind of moving away from that attitude in hospitals, which is a really good thing. It shouldn't just be about brown nosing or trying to suck up to somebody just so you get in their good books. Hopefully, eventually we can get to a point where everybody is just treated purely on their skills and what they can bring forward rather than just how much chocolate they've given to somebody.
ATTAWAY ER. What do you got? How many more incoming? Ambulance bay needs hands. Page Dr. Hembry and everyone on call. Metro bus crashed downtown. We're about to be at capacity.
What can we do?
Nothing. Maeve.
Pretty accurate. I hope they remember this and don't try and overstep their bounds in any way. But I got a feeling that that's not going to happen. So let's see.
This is Maeve. She's our top second year. She's gonna finish the tour while I go home. I'll be back when I can. Follow me?
This is gonna suck.
Oh God, just go then. Just leave. Just leave. Why can't you just leave?
As first years, you're responsible for Franklin.
Who's Franklin?
This is Franklin. He's a little temperamental, so gotta make sure you clean him out nightly.
Shouldn't we be doing more than learning how to make coffee? There's an emergency out there.
I was getting to that.
What, and you wanna do something? Hold on. Do you not remember that lady who just said you can't do nothing? That's the one thing that she... I got a bad feeling about this. I feel like she's gonna start doing things instead of doing nothing like she was told. Let's see.
So, why did you volunteer to work in a hospital?
I got arrested. Beats juvie.
He got arrested, so I'm guessing he's got some kind of criminal record, and they were like, hey, let's send him to a hospital with a lot of vulnerable people. I mean, I don't know what crime he's done, but it doesn't really seem to follow through.
Hello? Hey, do you work here?
Sure do. What do you need?
Wait. What do you mean sure do? You don't work there, all right? You're a volunteer. You're not getting paid. You don't have a job. She seems like she's so eager to get in trouble. What is she gonna do? God, please.
I'm a little worried right now because I'm losing a lot of blood. And my favorite sweatshirt.
You should be fine to wait a little. If you hit an artery, you would have passed out by now.
That's comforting.
Use this instead. Lots of pressure. And soak it in cold water. The sweatshirt.
Oh, thanks.
All right, this is the problem, right? You can't just jump in and just start doing stuff without knowing what you're doing. If this guy's just come in and he's got this massive wound on his arm and she's just gonna wrap it, like, has she cleaned it? Has she checked for any foreign bodies? Like what is her plan here? She just wants to get involved and get hands on. And I get that, you know, sometimes it can be exciting. I remember my time when I first started working as a doctor, you kind of want to like be involved. But to be honest with me, there was just more of an overwhelming anxiety of having responsibility. It seems to be the case that those that don't have the responsibility want it more than the ones that do have it, because if you do have the responsibility, you know that it comes with a lot of risks, and that if you do something wrong, you can get in a lot of trouble. So the fact that this girl is just nonchalantly treating a patient, God knows where she got that gauze from anyway. Yeah, this doesn't and shouldn't happen.
She's close to coding.
Come on, show me a vein. Come on, sweetie.
All right, I've never heard anyone say, show me a vein, show me a vein. I've never heard that. To be honest, even doing this, like tapping on the vein, it's not really common practice, and it's not even recommended to do as part of the like blood taking or cannulation procedure. Cannulation is basically when you put like a thin plastic tube into someone's veins so you can give them medications, which is what I assume they should be doing at this point. I don't know why he would have like a syringe. Like where is he going to put that syringe? You don't just inject someone's veins with a syringe straight away. You put a cannula in first, and then you can administer drugs through that cannula. So don't know where this guy got his medical degree, but a bit worried right now, to be honest.
Hey, that's mine!
Eat your food.
What are you doing? You can't just force him. Here, let me try.
I love how he's wearing a hairnet, but like his hair's just completely falling out everywhere.
Stevie, sweetie, you need to eat to get big and strong.
Yeah, she's not doing much better either, to be honest. Like, you should be tying your hair up at this point.
How about the airplane?
So not only did this guy blow into his gloves, but he's just like touching his face with them. And what's the point of wearing gloves? Why are you wearing gloves? This is a bit of an issue like nowadays as well with this whole coronavirus thing. Like everyone's wearing gloves, but then they're just touching their faces and just acting like normal. You might as well not wear the gloves and just sanitize your hands every few minutes. That would probably be better, to be honest.
What are you doing?
Oh.
Don't come any closer.
I don't think that's gonna hurt anyone.
Depends where I put it.
Where is she planning to put it? I don't think I want to know.
You're new TV, aren't you? I had a reason to be in here. Some of us have work.
Am I supposed to congratulate you?
If you want to.
Oh, the cringe. There's nothing more cringy than watching like teen romance, man.
BP's too low. I can't find a vein.
He's still trying. He's still trying to get a vein, mate. But it's too late now. It's too late now. And why are you the only one there? At this point, there would be at least like 3 or 4 doctors and like a few nurses. There would be enough people around that somebody could be trying to get a vein. Somebody could be doing like what this nurse is doing in green with the oxygen. To be honest, at most times you'll have like multiple people trying to get a vein at the same time. So you'll have one guy on the left arm, somebody on the right arm, maybe someone if they're really struggling, maybe someone on the foot. And eventually, if they can't get a vein, you try to get intraosseous access, which basically means you use this kind of device to drill into the bone, usually in the tibia, and you can actually administer fluids and medication through that way if you absolutely need to. So the fact that there's just 2 of them, this one guy who's still trying to find a vein with a syringe, again, not a cannula. I'm not optimistic for this little girl, unfortunately.
Hands. You, come here.
It's her first day.
Get over here. Come on. Grab on right below the elbow and squeeze as tight as you can. Now don't worry about hurting her. Good. Man up.
Wait, below the elbow? You're supposed to squeeze above the elbow. The whole point of doing that is that the blood in your veins that is trying to return up to your heart gets pooled below the point where you're pressing. If you're pressing below that point and you're trying to put the needle in above where you're pressing, that's doing nothing. You want more blood in the area below there so that the vein swells up. So I don't know what is this? What is this?
And we're in.
What the hell is that? Why are there so many colors? Is this like a Skittles ad or something? Trace the rainbow. That's way too many. I mean, I don't know what they're trying to portray there. Is that supposed to be like a full, wait, how many? 1, 2, 3, 4, 5, 6, 7. It's 8, so it can't be a full ECG view. And a lot of them look the same. So I have no idea what this is supposed to be showing. The main things you kind of need to see in this situation will be a single trace, oxygen saturation as well, and also blood pressure and heart rate. But in this kind of acute situation, you won't have access to other things like measuring CO2 levels, for example. So I have no idea what those things are.
Keep up the rescue breaths.
Nothing changed. Nothing changed. It looks exactly the same. If anything, it looks worse. I still don't think they've cleaned his wound. Like, he's still got blood dripping all the way down his arm. And because she put that bandage on, now everyone that walks past is going to be like, oh, someone with credentials must have put that on. So everyone's going to assume that it's been cleaned and treated properly, and no one's going to do anything about it. And then 6 hours later, this guy's going to have a fever, and then he's going to have full-blown cellulitis and sepsis. So yeah, don't do that.
I got this. Pick your poison.
I mean, at least she's completely given up on the hairnet and masks now. She's seen these two and she's like, forget it, what's the point?
There was this boy, he was bleeding everywhere, so I saved his life. And then Dr. Henry called me over out of all the nurses in the ER.
Next time on ATTAWAY General.
Oh, there's a next time.
That's Dr.
What an experience. I sincerely apologize on behalf of the medical profession to any of you that have watched this show. I don't know what to say. I'm speechless. Let me just say that volunteers are some of the nicest people that you meet in hospitals, because most of them are there because they actually want to be, hence the term volunteers. So they're always really friendly, really cheerful, always willing to help. Just the amount of sass and attitude. Is this what entertainment is nowadays? Is this supposed to inspire kids to want to work at a hospital? I feel like if it was me, it would put me off. Hey guys, look, hospitals are not this bad, all right? They're not this cringe. They're not this cheesy. They're not full of these kind of annoying people. So if you do want to volunteer at a hospital, by all means go for it, but don't expect it to be like this. It can actually be a really good experience, and you can get to know patients and other professionals well, and it can be a really positive thing in terms of understanding the struggles that a lot of patients go through. So I would recommend it, but if you are going to do it, be genuine, be humble, be sincere, and you'll get a lot out of it. I feel kind of bad for like bad mouthing basically kids, but come on, this is like a public show. It's got more than 5.5 million views. I think they can take it. They're probably doing well for themselves. So anyway, yeah, thanks for watching, guys. If you enjoyed, please do leave a like and subscribe if you want to see more from me. Let me know if you want me to do more of this particular series, or if you think there's something better for me to react to, then leave that in a comment down below as well. And as always, stay safe, guys, stay healthy, and take care. Peace.